So today we'll be talking about birthmarks, but in particular brown birthmarks. So birthmarks, I like to divide it really easy, red or brown. Red birthmarks are really easy to remove, or much easier to remove compared to brown birthmarks. Now, in this room there are different lasers, there are different devices. None of these lasers really suit birthmarks. So when we're looking at birthmarks, we're looking at either a vascular laser or Q-switch laser. So this room contains like fractional lasers and ablative lasers and microneedling, Fraxel, a whole heap of things, but none of these are all absolutely useless for birthmarks, including the IPL over there. So birthmarks, let's move to another room. Come on through. Just follow me. V-beam laser is the treatment of choice for red birthmarks. Fantastic laser, but for brown birthmarks, I use a totally different laser. So we'll go to the next laser room and see what we've got. Okay, for brown birthmarks, these are my two lasers which I use, and they're called Q-switch lasers. Q-switch lasers equals brown birthmarks. So the laser of choice I normally use would be a pico laser, but in this case, or this particular patient, I'll show you, I've used the old Rev Light or even C6 using the 532 wavelength. So with brown birthmarks, you need a Q-switch laser. Totally different. These lasers fire pulse energies in very, very short pulses. So very short pulse durations. In other words, they dump a lot of energy in a very short amount of time. Totally unlike all the other fractionated devices or even vascular lasers. So these are specific lasers designed to shatter pigment. So the pigment may be brown or the pigment may be ink. So very often the brown birthmarks we use the same lasers we use as for tattoo removal, such as the Pico Sure, the Rev Light and the C6. So stay tuned and I'll show you how it's done.
Ordinarily I would use the Pico laser. However, this laser, even though it's an excellent laser, has not got the energy level at the wavelength I want at 532. So I swapped back to my old laser, which is the Revlite. This uses nanosecond technology, but it works. So let's have a look at the before. So this is what I'm treating, a café or lait macule. So café or lait macules are very common, but when they occur in certain areas like the face, certainly that can be a concern. So here I am treating this lesion with the 532 laser. You can see I've put internal eye shields to protect the eyes, and I'm lasering around there. And this is her third treatment, so you can see a marked improvement, and the end point which I want is just a little bit of frosting in that area, and that's perfect. The skin, let's have a look at the before. And let's have a look at how she heals up. This is what she heals like at day 6. So it takes about 7 or 8 days before the scabs go. This is what she looks like after the second treatment. You can still see some residual areas of brownness. And then what she looks like after the third treatment. So she had a fourth treatment just to clean up the areas. And at the end of the day, she's extremely happy because the birthmark she's had for 26 years is now gone. So hey guys, thank you very much for watching my videos, and for more on laser and aesthetic dermatology, please remember to subscribe. And once again, thank you very much for your support, especially for all the international viewers out there, plus the local guys in Australia. Bye.